Sunday Morning Magazine with Anna de Haro. The views and opinions expressed on this program are not necessarily those of this station or iHeartMedia. Join us for Sunday Morning Magazine.
Before we wrap up this morning, this past week it was revealed that Ashley Olsen, one of the Olsen twins from Full House fame, is suffering from Lyme disease, a disease transmitted by infected ticks. And Ashley is not alone in dealing with Lyme disease. As a matter of fact, pop star Avril Lavigne revealed this year that she too is battling Lyme disease. And here locally, on Saturday, May 23rd at the Fuddruckers in Bedford, people are being asked to take part in the Lyme Challenge to raise awareness about Lyme disease and to raise money for research. Joining me to talk about the Lyme Challenge are William and Angela Harding. This is personal for them because Angela was diagnosed with Lyme disease. William, Angela, welcome to the program.
Thank you. We're glad to be here.
Angela, when were you first diagnosed with Lyme disease?
I got my official diagnosis about 2.5 years ago. I was actually diagnosed with lymphoma first, and it...
Double whammy.
Yes, it actually has been discussed that I possibly did not have lymphoma, that the Lyme imitated lymphoma. So it's been a huge challenge the past few years to get that accurate diagnosis and get the accurate treatment to help me.
And what were your symptoms, Angela?
Extreme bruising, chronic fatigue. At one point I was coughing up blood. Just not myself. I'm a registered nurse and I could not remember things, and that was a big issue for me. I started having tremors and seizures, and at that point, I knew it had to be something more.
All of the symptoms that you just revealed do mimic lymphoma or leukemia.
Yes, they do. My blood levels were way off the charts. They were giving extreme signs of lymphoma, and given that I had a family history of lymphoma, it was assumed that that was the accurate diagnosis.
So how long before the symptoms and the actual diagnosis of Lyme disease? Because that had to be frustrating, not knowing exactly what was going on with you.
It was after 3 rounds of chemo were completed for lymphoma.
That they finally discovered.
Yes.
And Lyme disease is something that we often hear about, and we think, oh yeah, it's something to do with ticks, but we really don't know how someone contracts it. Do you know where and when you contracted Lyme disease?
Not exactly, no. I'm an avid hiker. I love to be outdoors. I love to hunt. And as a child, I spent lots of time outdoors in Missouri. We've traveled a lot. I hike all over Houston, all over the Dallas-Fort Worth area. We go to Wyoming and Colorado. But I've been bit by multiple ticks at multiple times of my life, so I really don't know which one did it.
And William, for you, as someone who has to see their loved one go through this, what do you want people to know about this disease?
To see my wife suffer every day, to even just move, to get out of bed, has been excruciating to watch. We wish we had been able to catch it earlier and possibly get better treatment or more advanced treatment in the earlier stages of Lyme before it started attacking her neurological system, before it started taking a toll on her memory and her ability to function through the day. Had we found a doctor that would have looked specifically for the Lyme's marker, then we could have caught it earlier and perhaps increased the ability to let her feel better, even just moderately better.
Her quality of life.
Absolutely.
So there is a test that they could have done a long time ago that perhaps would have led to earlier treatment.
There
are several different types of tests. The ELISA test, which is similar to what they use for HIV and AIDS, it will sometimes come up negative. Over 50% of the cases come up negative at first. There are so many biomarkers that they have to look for. And if they do a panel on a Western blot, some of the markers might show positive and some of them might show negative. So it's real important that you have a Lyme's literate medical doctor or an LLMD to analyze those test results. I believe that if I had had that kind of analyzation before, it would have been seen prior to the doctor who just happened to say, you know what, I'm going to test you for this. We're going to do this weird panel that I've heard about from one of my colleagues, and we're going to see what's wrong.
And thank goodness for that doctor.
Exactly.
Are they able to reverse any of the symptoms that you've had due to your Lyme disease diagnosis?
No. Any of the brain damage that's done is done. They can treat the symptoms. So they treat my tremors, they can treat my loss of vision, they can treat the Bell's palsy, they can treat the fatigue, but there's no way to get all that back.
This is Angela now.
Yes.
This is your new normal.
Yes.
It is. And we know going forward that this is the baseline. And now that we understand that she has Lyme and that we must treat it, we can hope to keep her even at this level and continue forward from here rather than digress any further.
And that's why raising awareness is key, because so many people that are in Angela's situation don't know what they're dealing with. So with that early diagnosis, you're able to stop the progression of the disease. And so tell me about, William, because you're the one that first emailed me and said, my wife, Angela, was diagnosed with Lyme disease, and we're doing everything that we can to raise awareness and to raise funds for research. Tell me about the Lyme Disease Challenge. It's coming up Saturday, May 23rd at the Fuddruckers in Bedford from 3 to 7 p.m. What's going to be taking place?
We will have a section set up for anybody to come out and take a bite out of a Lyme. We'll take pictures of those who will take a bite for us and hope that when they do, they donate $10 towards the Take a Bite Out of Lyme challenge.
This is a social media campaign, much like the ALS Ice Bucket Challenge.
Right.
We're going to be posting pictures on Facebook, Twitter, Instagram, all social media to raise awareness about Lyme disease.
And then you can challenge somebody else to take a bite as well. You know, if you've gone through and taken the bite of the sour lime and gotten your squinched up sour face on camera, you get to tell the next person who gets to take the bite out of a lime for us. We're also going to have a silent auction. We're getting some really nice donations. Our friends, family, and colleagues are donating. There's some antique furniture. We've got a hand-drawn picture of Elvis from a tattoo artist in Colorado Springs that's just amazing. The rest of it is going to be information sharing. We'll have tables set up with facts and question and answer. We'll be there to guide anybody who has any questions. And if we don't have the answer, we have resources to find the answers to some of the questions. But mainly, it's a chance to get together with your friends and your family, to be with your family, and everybody has known somebody that has had Lyme disease.
And if you spend any time outdoors, you're at risk, because you never know when that infected tick could be out there when you're out walking your dog at a nature preserve, at White Rock Lake, on the Trinity River. We're all at risk of contracting this disease.
We definitely are.
And anyone that has animals, when they come into the home, if there is a tick, you need to look at those animals, because if they do get on your children while they're playing, then that can be a big issue. And contrary to what people say, it does not have to be on your body for longer than 24 hours. A bite is a bite. And if you've been bit by a tick for any length of time, you need to get medical treatment immediately to find out if you've been exposed. The other thing I want women to know especially is that if you do contract Lyme, it can be passed to your unborn child. It does travel through the placenta. And so it's even more important to me for women to make sure that they're tested if they have any kind of symptoms.
So raise awareness about the symptoms, about the disease, and also raise money for research so that we can find a cure for Lyme disease. Besides raising funds and taking a bite out of a lime, tequila and Corona beer not included. Get your own.
Bring your own tequila and Corona. You might have to put it in a brown paper bag.
But I love the fact, William, that you have come all out. You are sporting lime-colored hair in support of your wife and of the Lyme Challenge. Where is the money going, the money that's raised for the Lyme Challenge, Angela?
It's going to the International Lyme and Associated Diseases Society. So it's the ilads.org. All the funds have been allocated towards them, and they are a panel of physicians and medical professionals that are campaigning to the CDC and to the government to reevaluate how this is looked at. For so many years, it was, oh, you got a tick bite, take a few antibiotics, you'll be fine. And so now they're seeing that that's not the case. And so this is the organization that is raising awareness and raising funds.
Are you hoping that with the diagnosis of a celebrity like Ashley Olsen or Avril Lavigne, that it raises awareness and gets more people involved in this cause?
I hate to see that they have been diagnosed, but yes, unfortunately, I do hope that. I hope that a larger name in society can raise more awareness similar to when famous basketball players got AIDS.
Yeah.
You know, I hate to see it come to that, but I am hopeful now that we'll get a little bit more awareness out there.
Well, you have a wonderful man by your side, your husband, William.
Thank you.
Do you have any other support out there? Have you reached out in blogs talking about your disease? Is there somebody else who can understand what you're going through, Angela?
I have my own personal blog. It's rusticforlife.com. The World Lyme Foundation has been a huge support for me. World Lyme Day on Facebook, when you look those kinds of things up, the people that are behind those organizations, most of them have either lost a loved one or are currently battling Lyme disease. And unfortunately, suicide is a huge risk because of the neurological depression that occurs.
It's one day at a time, Angela.
Yes, definitely.
The 2015 Lyme Disease Challenge, it's taking place here in North Texas, raising funds for research and also raising awareness. It's going to take place Saturday, May 23rd between 3 and 7 at the Fuddruckers on Airport Freeway in Bedford. You can find out more at LymeDiseaseChallenge.org. And once again, your blog, Angela, is
rusticforlife.com.
rusticforlife.com. Angela and William Harding, thank you both so much.
Thank you. We appreciate being here with you.
Thank you.
You've been listening to Sunday Morning Magazine with Anna de Haro. The views and opinions expressed on this program are not necessarily those of this station or iHeartMedia. Join us again next Sunday morning for Sunday Morning Magazine.